Hello and welcome to the second of 3 videos which have been designed to work with organisations across North Queensland to identify what steps can be taken to work collaboratively to creating healthy communities. This video, the second in the short series, looks at what works well when it comes to creating healthy communities. We're going to talk very briefly about some of the issues and challenges faced by rural and regional local governments in relation to building healthy communities. We're going to look at what programs work and why do they work and what are those steps that make them successful. Then we're going to explore very briefly 4 simple steps that can be taken as part of collaborations to work together to build healthy communities with a focus, of course, on North Queensland. And then we're briefly going to explore an action plan and some examples of Australian work that has exemplified ways of creating strategic and overarching plans and then breaking those into smaller, more achievable projects and programs on the ground, which collectively work together to build that notion of healthy communities. So we know that the role of local government in improving public health has been given legislative recognition in some Australian states. And of course, there's growing evidence and recognition of the important role of local communities and local governments working together with local organisations to really align that work around health policy that's locally relevant for programs, for services, for initiatives around healthy place, healthy people, and healthy policy, and how that collectively works together to build healthy communities. We also know that there are some challenges and health disparities in rural and regional areas, and that's why it's really important for those initiatives to be locally driven and locally sustained, so that we know that the work that's happening in local communities is relevant for those local needs. Ways of looking at implementing healthy public policies and programs and services can sometimes be managed around a series of issues. And these ones can include things like the role of leadership and maybe other political and policy strategies that are happening. So who is going to take that leadership in creating those healthy communities? In some instances, it's the local government. In some instances, it might be a service club. In some instances, it may be particular workplaces, consortia of schools, or it might be community collaborations who get together and take on that role of leadership. We know that funding can be sometimes a bit of a challenge, but we like to consider turning that into an opportunity. And we know that a good strategy to create healthy communities will always need to be supported by some funding, but there are also ways to look at where the funding comes from, usually within communities, and how that can be drawn upon to be directed to support those prevention strategies that also support building healthy communities. And in the case of what we're talking about here today, around building healthy communities to look at chronic disease prevention. So that's particularly looking at those risk factors that relate to those chronic diseases, which may have some element of prevention. So particularly chronic diseases like some cancers, heart disease, diabetes, where we know that the burden on our population is very high, but that with some simple behavioural and policy and place changes within communities, we can have a positive impact and potentially reduce that burden of disease from those chronic diseases. And those behavioural risk factors relate to issues like tobacco smoking, unhealthy eating, a lack of physical activity, and also sun exposure and a lack of sun safety. All of these contribute towards some of those chronic diseases. So they're the kind of behaviours that we're talking about when we talk about those health promoting strategies and ways to create healthy places, such as through connected walking paths, shady spaces, physical activity opportunities, access to healthy fruit and veg, that can all help contribute within the place where our communities live, work, play, and learn. We know that on the ground then that some of the other challenges that contribute to that can also be in relation to staffing and sometimes management structures of the organisations in which we work. There can be different priorities in the community, and that's important to be recognised in any kind of planning towards healthy communities. Sometimes dedicated public health staff are lacking on the ground, and that's where identifying the role of the key organisations and key community members who are part of the community is important, because really if we all work together collectively, that's how we can build healthy communities. When we look at what makes a Healthy Communities program work, we've looked at the work from South Australia, which has been quite strong in this area. Now, we know that in Queensland, it doesn't mean that we can simply pick up some work that's happened elsewhere and plonk it in Queensland and assume that it will work. But we know that by being guided by some of the evidence that has worked in other places, and if we can adapt that locally and make sure that it's locally driven by community and locally driven by community organisations with collective planning, collective implementation, and some good evaluation and impact around it, that we can then make sure that our healthy communities are locally driven, locally planned, and locally appropriate. And that's, of course, what we want for our North Queensland communities. So sometimes to look at planning this, it can be based around these 4 very simple steps. And that includes setting the foundation, so finding the support, identifying the resources, and starting the conversations. And if you're going to be part of a community consortium or maybe a lead organisation that might be the mover and shaker to getting things happening to build those healthy communities in your area, you might be able to use this guide of the 1, 2, 3, 4 simple steps as a bit of a plan to guide the work that you do to build up those initial steps around healthy communities. So finding the support, identifying the resources, who are the leaders, how can this work, and how can it be integrated into the way that your communities work already. Starting conversations is also really important, because buy-in and participation from local community, local workplaces, local organisations is crucial. And this is also really important to be broader than the key obvious health sector. The more variety of different organisations and different sectors who are involved, the more representative it is of the full community that you'll be wanting to work with. Preparation is the second step. Plan for community needs, existing mechanisms, and sustainability. So it's really important that any local healthy communities program and plan are fully focused on the local needs of that community. So in the first video presentation of this series of 3, we touched briefly on some of the needs assessments from the North. These are well documented and easily accessible, and certainly the North Queensland Primary Health Network Needs Assessment is accessible on their website, giving up-to-date data of local needs of local communities. Looking at planning and preparation around existing mechanisms and being able to integrate healthy communities into the way the community already works is really important. So, for example, thinking about how do other policies and practices happen within the community? How does this work? Well, is it a mining town? Is it an agricultural town? Is it a town that's based on education? Is it a big centre, a big regional area, or is it a small regional rural area that might be well isolated from a number of the major centres? All of these factors, plus many more, are really important in identifying the existing mechanisms of how the community works. And that's where we want to think about integrating those healthy activities, healthy strategies, healthy programs and policies into the way communities already work. And that will naturally start to build towards sustaining those practices long term. The third step is around planning and implementation, making an action plan. And often the best way to do this is a physical, printed or documented virtually action plan that has the agreed actions of what the community will work towards together, who will be responsible, and what some of those incremental celebration steps are going to be along the way. We all know communities love a great celebration, and being able to incorporate some short, medium and longer term goals and little achievements along the way that can be celebrated are all really important parts of community engagement along with this healthy communities approach. Identifying the barriers is also really important. There are always things that are going to get in the way of healthy communities, and these are going to be different across communities. There might be some shared barriers and there might be some commonalities, and things like funding is often one of those. But the way that that's executed and the way that that's overcome may be very unique to your community or your group of communities. So it's important to think about that locally. Deciding on engagement techniques is really important. Are there already ways that the community gets together locally? How do they engage in some sort of consultation? Are there regular meetings? Are there regular social media networks? Are there newsletters, newspapers, media outlets that engage communities together? Are there big gatherings at sporting events where community naturally comes together anyway to celebrate something locally? Even the local shows can be a great way to engage community. And engaging community around how the health of communities is going to be built and how those steps towards an action plan might come together as part of a normal way that community comes together. Maybe it's race day, maybe it's the show, maybe it's sporting activities, maybe it's at the sale yards. These are all really important things to think about because it's the usual way community engages. Step 4 is around that reflection and brainstorming. And this is important to do incrementally. Reflect on what's working, adapt as necessary, and then look at embedding that into the usual way community works. And this is where the organisational role comes in. Whether you're a local government, a school, a workplace, a government department, a federal government department, or a private entity, a social enterprise, a not-for-profit, everyone can play a role. And it's important to think about what will your organisation's contribution be towards building healthy communities. You might be going to be the lead organisation or a contributing organisation, but embedding those healthy actions into the way that your organisation works is also the best way towards sustainability. Setting the foundation is really important. It looks at leadership support, community support, resources, conversations, connections, and that asset-based community design. And you may well want to pause on this slide at this point of the video and take some notes, take a photo, take a screenshot, something like that, that helps to use these kind of points to look at documenting that plan or that series of actions that you might like to engage in to help building towards healthy communities. This preparation step is really important, as I mentioned earlier. Regional public health and other relevant council plans need to be considered as to how this healthy communities plan may be engaged, executed, or combined with the current work that's happening. In the vast majority of communities, there's already a range of healthy activities happening, but it's looking at how we can collate those together so that we know that they're being coordinated, that there's mutual action, and there can be some measures around what's working and what's not working. That's also important looking at community needs and priorities, those existing mechanisms we talked about already, the planning for sustained improvements, and how we'll know that success can be planned. How can we measure that positive change in the system, in the community, and locally? And again, at this point of the video, a screenshot, a photo, or a jot down some of the notes from this slide will also be useful in setting those steps that maybe your consortium, committee, or action group might like to work together towards to build that healthy communities action plan. Now, getting onto that action plan is really important. We've got some examples soon. There's all sorts of different templates that you can use. You may well have an existing strategic planning template or something that's worked well in community already to be able to use. but that will ultimately identify what you'll do, with whom and when. The accountability is really important. Who's going to lead that? Who's going to be part of that team and in what time frame? The barriers and enablers are really important to identify at this point too. What are those sticking points going to be? And we need to acknowledge those right up the front and how we might just deal with those or maybe overcome them. How to get the community involved or informed is also really important. And those usual ways of communicating with community is the way to do that. It's often cheap or free of charge, and it's a guaranteed way of engaging the community through the usual forms of communication that they're used to engaging with as being members of those communities. And then looking at adaptability, how to make ongoing monitoring and feedback flexible. Is there going to be a centralized email address? Is there a social media page? Is there an ideas box at the local centre, maybe outside the town hall or something like that? Is there a Twitter handle, or is there something at some of the places where people get together all of the time where they can come together and give that feedback ongoing? In some communities, this can even form into an art form. Sometimes there's maybe empty shops or empty spaces that can become like art comment walls as well, where community can come together and share in quite a public space their thoughts around what might happen towards, what could happen locally towards building a healthy community in our place. Reflecting, adapting and embedding is really important. What is the data telling you about the scale of the change? What feedback has there been? And were the changes you didn't expect? How can you brainstorm with others to identify what might happen from here? How does that adapt locally? Remembering that any success in healthy communities is going to be locally driven, locally owned, and locally implemented. And then importantly, how can we embed this in terms of maybe policy or other ways of practices locally to sustain that positive change? This is an example of an action plan for healthy communities. Like I said, there are loads of different ways that you can identify what this might mean. This one does have a number of columns, and it's particularly related to the council being the driving force. But what they've done here is identify very specifically what the health and wellbeing issue might be, what those relevant council plans and strategy documents might be, the tasks involved and who's responsible, the resources required, and the indicators of success. And this is the reference here that we can provide for you as well. So here's just a little example, and many of you will be familiar with this one because it is a North Queensland area, of course, and we couldn't help but throw this one in as an example. So promoting active lifestyles, as you know, has been a strategy in Mackay. Now, it's really important to think about these very localised examples as being part of a broader suite of strategies and programs that might happen and be outlined in an action plan for healthy communities. What these kind of specific examples do that way is show how a broad, maybe longer term goal that's in the Healthy Communities Action Plan can be pulled apart into very tangible and very short-term achievable strategies that happen on the ground with great visibility and engagement for community, but that they don't lose that longer term overarching kind of long-term goal to make sure everyone is working together for the longer term, and that this doesn't become something that starts and stops and doesn't then continually contribute to building healthy communities. So some of that work from Mackay, of course, showed benefits of interdepartmental partnerships with councils, linked a range of council objectives and goals to improve access to resources. The program sought to accommodate working habits of the local community and link programs that are driven by different goals, example, improve physical health and economic development. And it's important to make sure that we link those complementary determinants, health, economy, social, crime and safety, things like that together to make sure that collectively they complement each other in building healthy communities. And this, as you well know, are some of the actions that had happened around some of the work happening in Mackay. Identified increasing physical activity, free exercise activities, existing council levy on local CBD traders to fund some of that work, local providers to run the activities, relaunch some programs, and then also acknowledge the work through some celebration. So a number of small, achievable, but connected steps working together. Here's another example outside of the north, but of course still in Queensland, from Maranoa Regional Council. This particular council program looked at improving local food supply and aimed to improve access to accredited nutrition and physical activity programs, using a whole of community approach with targeted responses for at-risk groups, and was the importance of council workplaces being a role model for other businesses. They looked at a range of free activities, short courses for catering was offered. There was maternal and infant nutrition workshops, a range of healthy food options and resources developed. There was also a series of community ambassadors that were engaged voluntarily with the program to be on the ground and integrated within the community, and a series of evaluation methods to make sure that they could report those short, medium, and potentially longer term benefits of this program. Now, another great example, we've got the website down here so that you can access that yourself to have a look, is a wonderful organisation called Queensland Walks, who work extensively across the state, particularly focused on local governments and healthy built environments, to encourage Queenslanders to walk for exercise, for commuting and transport, and as part of their everyday activities. So we'd certainly encourage you to check out the Queensland Walks website as a great example of how communities can engage with other organisations that are doing some fantastic work. Now, that's a really important thing to remember. When those healthy action plans are being developed, it doesn't mean that the programs all have to start from scratch. Queensland Walks, for example, has a range of different programs and services that can be accessed. Cancer Council Queensland, the same. Heart Foundation, the same. There are a number and range of all sorts of different organisations that run particularly fantastic programs, like 10,000 Steps is another one that's very prominent in Queensland. Here is a series of resources and references then, if that's of interest to you then as well, to continue your journey of working towards how to build that healthy action plan for your community. So I hope you join us now for video 3, the last one in this short series of videos, to start kickstarting and activating work in collaboration to build healthy communities across the north.